we want to welcome you all to our Prostate Cancer Awareness Day that is live on video. I am so happy to be here, but we will be remiss if we first don't mention our partnership, AdMeTech and the Brockton area branch of the NAACP for bringing this live feed and sponsoring this work that is important work, a work that I've identified every time you all have allowed me to host is saving lives with respect to prostate cancer. So thank you all. I want to first acknowledge the Brockton State House delegation that is also here. We have Representative Jerry Cassidy is here. Rita Mendez is here. These are champions of the prostate cancer educational program for men that are at high risk. A priority focus on African Americans, Hispanics, and Latino individuals. I also want to acknowledge that Senator Brady was going to be here, but he had another event. But in any event, let's give that delegation a hand clap for those that are watching us live and those that are here. And I hope, my other state delegation folks don't get upset. We still have other favorites that are a part of our programming. State Representative Mendez, will you give us a welcoming statement?
Yes, absolutely. I would love to. So this is a really important day, and especially in the minority community that maybe they don't think it's that crucial to get tested, and awareness. And this organization is so committed to bringing awareness and saying how important it is. And it's been challenging at the State House, especially with the 9C cuts, but our commitment is still here. We're still fighting every day to bring in the funding and the resources that it's needed. And I know our lovely Jerry Cassidy, our state representative that really initiated this, has been a strong supporter since day one. He is leaving the legislature, but I'm sure that all of us that are going to remain and the person that is going to come in after him will continue with this mission, because it really is a goal that affects the city of Brockton, especially which is a city, the majority of the population is minority. And we are committed. Just know that at the State House, and our senator as well is committed to making sure that funding will keep on coming, that this program will keep on working, and that commitment to the people that's so much needed. So thank you so much for the opportunity. And I am so glad and honored to be here this evening. Thank you, Bishop.
No, thank you, Representative Mendez. I want to give you the hand clap because this delegation has been upfront and forward in helping us, making sure that there is funding in this fight. I know Dr. Stearns will verify that, Steve Bernard. So listen, I want to hug you because it is well-deserved work. And it's not just the fact that you all are, the words that you're using, your support of the community at large is just overwhelming. And I just want to thank you for that. But, Representative Mendez, you kind of just got there. Pardon me, but, Jerry's been a friend. Jerry's done a lot of work. Jerry, you've been on top of this as well. Can you please, State Representative, give us some opening remarks, Representative Cassidy?
Bishop, I just want to thank you for everything you do here in the city of Brockton. You're well loved throughout the city. I appreciate it very much. Steve Bernard, I mean, he's through and through one of the nicest people I've ever met. Phyllis Ellis, of course. Leona Martin and Janet Trask, thank you very, very, very much for everything. I've been doing this program since 2016. Right. Each and every year I go before the speaker and the budget looking for funding for this program, because it's well deserved. It's very important to Brockton. And whenever you go into the State House and you see a Dr. Stern walking up and down the halls trying to talk to the other reps, it's unbelievable what she has done for this NAACP and AdMeTech and the issue that we're talking. The only thing that I really wish that we could do is put an actual number on how many people we've saved over the years since 2016. It's really a difficult thing to. Data is very, very important when you're going into the Chairman of Ways and Means. I know of at least 3 people that this program has saved. Moving forward, I think that that would be
we could actually estimate we can actually estimate, Jerry, because we have data from NCI over a 5-year period.
Right, right.
And because of the sharp decrease in mortality, we can estimate how many people were saved.
And that's the most important part when we're looking for funding, talking to the chairman of Ways and Means and the governor and everything like that. But as you can see, Dr. Stern is one of the kindest people, and this is a very,
Yes.
very important issue here in the city of Brockton. So I just want to welcome everyone here to the program, and always looking forward to jumping in conversation later on. Thank you.
Representative Cassidy, we would be remiss if we didn't, I mean, you're retiring. As far as we're concerned, going too soon. You've been such a staunch supporter, and the NAACP, we're a civil rights organization. You've been at the forefront with us, holding our hands. So I think this is really an opportunity for me to acknowledge that, give you this hug through this video, but also to tell you, job well done, service well done. Thank you
Thank you.
so very much.
Bishop, could I interrupt? I'd like
Absolutely.
to say about Jerry. If you don't mind, Jerry, known Jerry a very, very long time. So Jerry Cassidy. Jerry was elected March 2016 to the Massachusetts House of Representatives, the 9th Plymouth District, representing the city of Brockton in wards 2, 3, 4, 5, and 7 in various precincts within those wards. Prior to becoming a legislative representative, Jerry worked as an aide for the late Senator Tom Kennedy for 28 years.
Yes.
And Jerry also served as a Brockton City Councilor, for those who didn't know, and still is on the Brockton Democratic City Committee. Jerry represents the people of Brockton with care, with passion, with compassion, and dedication. Most importantly, with effective legislation. Some of Jerry's legislative petitions include matters concerning children, families, and persons with disabilities, consumer protection, financial services relative to insurance premiums, healthcare financing, healthcare protection and services, property taxes, and many other matters that impact residents of Brockton on a daily basis. So, the Brockton branch of the NAACP, President Phyllis Ellis, the Executive Committee, and NAACP members, thank you, Jerry, for all that you have contributed to civil rights, and particularly as it pertains to our partnership with AdMeTech Foundation, your contribution to closing the disparity gap in healthcare relative to prostate cancer. Jerry, we wish you Godspeed and a rewarding future. We're so sorry that you're not running for elected office again. We're going to miss you. We love you. But before you go, I have to give thanks to your chief of staff, because I'm sure she kept you on the straight and narrow all these years. So the thank you goes not only to Jerry Cassidy.
Thank you. I owe you lunch, Steve. Thank you.
And actually, Jerry, I cannot even begin to express my gratitude for all of your incredible support. We met you in January 2016, right before you were reelected. Thank you for being an incredible partner. Together, we've made a considerable difference in Brockton based on statistics that we are looking at, and based on the stories we are hearing from individual men. Thank you so much for all of your support. And Bridget, the way you always supported us, and the way you would come out with our budget amendment, with already almost majority members of the House supporting this amendment. Since the first year we started working with you and Jerry, we were all of us at AdMeTech were amazed by your work. Thank you so much for your support.
Thank you very much, Doctor.
And actually, we have an award for you.
That's wonderful.
But here
Thank you.
is
Wow.
an award from AdMeTech Foundation and Brockton Area and NAACP, its Leadership Award. It is presented to Representative Jerry Cassidy, tireless champion of prostate cancer education, research, and healthcare equity. Jerry, thank you so much for all of your support.
Thank you. I'm just
you so
honored to work with everyone here. Thank you.
Thank you so much.
Thank you for that, Jerry. Thank you for putting in that awesome service, State Representative Cassidy. Next person does not require much introduction to the community. This is a mayor that not only has been committed to the fight against prostate cancer, he's been readily available for PSA and at times even some tears. Ladies and gentlemen, Mayor Robert Sullivan, City of Brockton.
I want to first of all thank you, Bishop Branch, in your capacity as first vice president. I want to thank President Phyllis Ellis, Brockton area branch of the NAACP, the executive committee, all the board members. I want to thank Dr. Stern and AdMeTech. I'm really excited to be here again. We have to work together to continue to fight against prostate cancer and to educate and inform people. And you know, the stigma of men being tested shouldn't happen, right? We need to do regular early testing. You need to get your blood work. Your PSA test has to be screened on a regular basis, which is the prostate specific antigen. You have to do it, right? It's so important to know your numbers. Also do it on a regular basis. And you know, as I've said before, my father is a prostate cancer survivor, and I've had many friends. I just turned 54, and I want to thank you, Leona. We're Taurus the Bulls together. You know, a lot of my friends in the 50s and 60s have been dealing with prostate. And the man that actually brought this to my attention was Steve Bernard. I was a city councilor at large. Steve came to me, educated me about the disproportionate numbers of African-American men that come down with prostate cancer as opposed to Caucasian white men. And filed the resolve as a city councilor. He came before the city council. He educated all 11 members, and the rest is history. You know, the NAACP is always working to better the community for civil rights and for justice, but also for health, right? We have to have proportionate share of health. And so today, as the mayor of Brockton, I just want to publicly thank everybody. I want to, again, thank the pastors. We will have a lot of clergy and pastors on this call. Their reach to the congregation members and their church members is much farther than mine as mayor. So if we continue to work together with AdMeTech and with the NAACP and our wonderful delegation that always fights to get the City of Champions money, we will tackle prostate cancer. So let's continue to work together. And again, I'm just so excited to be here. And I truly thank everybody for taking the time on a Thursday night to educate, to work together, and to fight against prostate cancer. So God bless you all. Thank you.
Thank you, Mayor Sullivan. We really, really appreciate the service that you've put in with respect to this fight against prostate cancer, and your words have echoed in our community. Thank you, thank you, thank you. Now, next, I know y'all might hear me say my favorite. When I speak of the select person chair from the town of Stoughton, Deborah, I appreciate that she's here. The Roberts family is here. Let me tell you what I do know. When you talk about our community, we really do believe in oral history, and we really do believe in hearing how the health has impacted other folks, and for us to really make the decisions that we're going to go see the doctor. But hearing the testimonial of the Roberts family should impact many. Select person, and I know your family's here. Can you tell us your testimonial with respect to how you dealt with this thing called prostate cancer?
Thank you so very much, Bishop. First, I would like to thank AdMeTech, and I would like to thank NAACP Brockton for inviting the Roberts family on your show again. This is just so wonderful for us to be able to tell our story. I'm talking from the female perspective of how we are impacted because a male family member was diagnosed with prostate cancer. But there's hope. It is common. I want the public to know that it is a common diagnosis. He was a first responder, And while he was out in the community talking to families, he would commonly talk to the Black families to ask, well, how are you doing? I'm experiencing some symptoms like frequent urinating or difficulty urinating. How about you? And that is a common thread that he and other families were expressing they had. So as I talked to Chuck, because I love him dearly, I was curious to know how many of your Black brothers, and you know I'm using that broadly, how many of your Black brothers indicate they have these symptoms and they're going to the doctor or not going to the doctor? And Chuck would say, it's a lot, Deborah. So it was not comforting to know that that was the response. So I'm asking all of our Black and brown brothers to start getting tested. Ask your doctors to have your PSA tested starting at age 40, because these tests will save your life. Black and brown men are 2.5 times more likely to die of prostate cancer. And we want to stop that trend. So with that, Chuck, please share, because this is important for them to know. It's nothing to be ashamed of. You have to talk to your doctor. So please share your experience and what other Black and brown men have shared with you. Your friends even.
And thank you for having us on here today once again. I am a survivor of prostate cancer. I was diagnosed back in November of 2020 and underwent treatment for 2.5 to 3 years. I'm on the recovery end of it. I'm still dealing with the side effects of the treatment. I went through chemo, hormone therapy, and also radiation treatment. The last time I had any type of treatment at all was back in August of 2022. It's been a little over a year and a half since I've had any type of treatment at all. So I'm still in the recovery phase. I still have to see the doctor every 6 months. And every time I've been in to see him, I'm still doing very well. Some of the people that I have been in contact with, that I have told my story to, and now they're starting to have problems, so they're asking my advice. It's probably about 2 or 3 close friends that are starting to have problems now, and I've told them my story, and I've also told them that depending on what stage you're in, you should have several different conversations with your doctor or doctors and determine the best treatment for yourself. I don't know anybody that I've known that's had their treatment has been the same as somebody else's. My treatment, when they found my cancer, I was at stage 2, and it was a very small area, so it was able to be taken care of, rather quickly. Other gentlemen I've talked to, having conversation with the doctors, they're just trying to decide on the best treatment for themselves. But I am encouraging everyone that I talk to that has a problem, see your doctor, have it tested on an annual basis, just like when you're going for your annual physical. And like if they detect it, they can take care of it. Even if it gets to stage 4, they can take care of it. But you can't just disregard what's going on. You got to see somebody about it. I have lost a couple of people that had it that didn't want to do anything about it. I actually lost 2 friends to prostate cancer. But I'm still encouraging those friends that I have that are now starting to experience some of those discomforts with that area to see a doctor and see what kind of treatment you can come up with. And the best thing to do is not to sit there, but to have it checked out. I'm encouraging all the time, and anything I can do to anybody else that needs some advice on it. I talk to people all the time on it, and I know it's been a thing with not just black males, but just males, period, that they just don't seem to want to address it. And if you let it go unaddressed, then you're going to have some serious problems down the line. So let's try and take care of that now. And I think my daughter Erin is on, so I'll turn it over to her. Is she on?
She's not on tonight because she has another commitment,
Okay.
but I
So-
know she would say that, go ahead.
No, I apologize. I mean, I know that you're short for time, but I just have to ask, take a personal privilege just to ask this question. So, select woman, you said that you started off by giving the woman's perspective. So I'm going to ask you both. Mr. Roberts, was it Deborah that encouraged you to get to the physician? Was it her that got you to the appointment? Did she suspect anything to encourage you or to push you to make sure you get into that doctor's office? Or are you just the type of individual that routinely got the physical, did the PSA, etc.? Tell me a little bit about the
Okay.
interconnection.
What happened with me was that I normally get an annual physical anyway. And my PSA was getting higher or elevating. And I was at the point, I think the time before this, the physical, before the one they determined that I had the cancer was, it was elevated and the doctors wanted to keep an eye on it. So then I was sent to see a urologist, and that's when they determined that I had cancer in a small area about the size of a quarter. And it was stage 2. So they told me there was several different options I can go with, but all I know was I wanted it taken care of. And they chose, they said they convinced me that the best therapy for me was chemo, hormone therapy, and also radiation treatment, which turned out to be pretty good. Now my prostate is barely a 1. It's not even 2, it's way under a 1.
Wow.
So that's every time I've gone in 3 times every 6 months. And it's down where it's supposed to be. The only side effect I got now is that I have real low energy, that it's going to take me some time to get it back up to where it should be.
So Chuck, just act like it's just you and I.
Okay.
God knows who's watching. I gotta ask you, because I know you've heard this.
Right.
PSA aside, we get the blood work. As of this afternoon, when I was telling folks that I'm going to be hosting this, I don't care what you say, Bishop. They're not putting their finger. They are pushing. Today, men are still saying no to the digital exam. What do you say to them? Because I know they're watching on YouTube or something. What do you say to folks that say, I refuse the digital exam? I don't want them to do that. What do you say to them?
I just tell them it can save your life.
It should save your life.
That's the way you got to put it to them. I'm not a big fan of the finger myself, but you got to do what you got to do. If you want a thorough exam when you go in there, when you get to a certain age, there's things that need to be done. You got to have them done if you want to be here.
Thank you, and God bless both of you for bringing this testimony. Real oral history of having the diagnosis, managing it to the point where you can say that word that we all want to hear, survivor.
Thank you.
Thank you.
Now, the next person that's coming up is what I know some of my colleagues in the clergy have always identified Pastor Creighton as the pastor's pastor. So listen, ladies and gentlemen, Reverend Houston Creighton, Lincoln Congregational Church. Bless you. Thank you, Reverend, for being here this evening.
Thank you so much for your kind invitation. I just want to be able to make a difference, and I think this is a great ministry. So with this whatever we can do, we try to do. And I'm just elated about what it's doing in our neck of the woods, and the people in my area ministry, pastoral ministry, who got so excited about the opportunity to join in with the program. So I'm better at starting stuff than finishing. So I want to start something for prostate cancer program, and the young men that are my spiritual sons and spiritual daughters, they have a lot of energy and they have a lot of things going on that really can really help the program. So thank you so much. I have quite a few of my folks tuning in. I saw quite a few names. She's in there, and I got some of the ministers of the church, Minister Penn, who just he had a testimony about prostate cancer recently. And there's another member, some Deaconess Brewster, Deacon Brewster, and she said no, there's reason that she came back to Lincoln. She had been gone for a while, and she got involved in that program for her nephew, which was, I understand, it's a lifesaver, and this is recent. So there's a lot of testimonies. If you need a record of what it's been doing, I can give you some. So very good. I'm so glad the mayor is involved with this, and he's a great mayor too, Mayor Sullivan. I've had him come to my church a few times, and it's just a blessing working with Steve.
Yeah.
His mom was one of my best members, and it's all his family known him for years. And I really I was talking about him today to somebody at the house. I'm just so excited about the different ones over in Cambridge. Leon Lamont and a friend over there, Kathy Bennick, and all. I can go down the list. There's so many. It makes me feel 15 years younger working with these people, but they have so much energy. They keep me young. So thank you so much for having me have a few words. And I'm good. I cleared my voice, so I'm good now.
Pastor, thank you so much for that. I just have, and I know I don't want to strain your voice, just a question around public awareness. When you look at all of us as men and women of faith, and especially the ministry, I can tell you as a Pentecostal, a lot of times folks say, "Wait, Bishop, I'm just going to pray it away." What do you say? And I know you know this. What do you say to our church members, our men and women of faith, that yes, we're prayerful, but what do you say to them, to the doctor's office, to get that PSA, to get that digital exam, and to quote Brother Robert, save lives? What do you say to the church members?
Well, it's like two little girls were late for school. The bell was getting ready to ring, and so the religious girl said, "Let's stop, honey, and pray that we make it on time." And then her girlfriend said, "I got a better idea. Let's run and pray." So that's what I did. So let's run while we pray, and works without faith without works.
Yes.
When you read that text, the been in church cover, faith without works is dead. There needs to be some evidence of your faith. And there's so many things God looks for us to do in all the healings that Jesus did. We all had to play a role in it. You know, we had to get on the road before we got our healing, and we had to touch His garment. The Lord always gives us a role in our own healing, and He does the ultimate healing He does. But in order for us to really appreciate what He does for us, He has to give us a role, just like our children in home. We have to have a role in whatever we do if we're really going to appreciate whatever success we have. So, no, I've touched on that many sermons, but I got my church pretty good to begin with. They have that spirit of that you're talking about, and I have a lot of school teachers. I have nurse practitioners and other members. We have a lot of medical staff, military, all that, and so I don't have to do too much work in that area.
Thank you, Pastor. Pastor, like I said, you are a pastor's pastor, and if you don't mind, I will be still and run while we pray because that's wonderful. That is really shed the light that we need, and we really, really thank you for bringing your perspective to this conversation. God bless you.
All right.
Dr. Sean Watson, who is not here in absentia. He's not able to attend, but provided a video of his presentation. Dr. Watson is a faculty member of the Division of Urology and Associated Physician at the Harvard Medical Faculty Physicians, Milton Center for Specialty Care, and the Needham Urology Associates of Beth Israel Deaconess Medical Center, Beth Israel Lahey Health, Harvard Medical School, excuse me. Dr. Watson will review advances in screening and diagnosis. I hope I've done him justice in that presentation. We now have a video that we will begin to play.
My name is Sean Wason, and I'm a faculty member in the Division of Urology at Beth Israel Deaconess Medical Center. I primarily work out of Milton and Needham hospitals, and I'm a part-time lecturer at Harvard Medical School. I was asked to give a talk on advances in the screening and diagnosis of prostate cancer. I have no disclosures related to this talk. We all may know someone that's been affected by prostate cancer. For me, it was my grandfather, Ernest Wason, who grew up in the sunny island of Barbados, the easternmost Caribbean island. I dedicate this talk to him. The objectives of my talk are to review the goals of screening. Who do we screen? When do we screen? How do we make the diagnosis? And how are we using imaging and biomarkers to screen our patients? Typical patient that may present to me in my office for prostate cancer screening. He's a middle-aged male. He has a strong family history of prostate cancer. Notably, his grandfather died of metastatic prostate cancer, and he has a brother who was recently diagnosed with localized prostate cancer and is undergoing treatment. He has no significant voiding symptoms. He feels well. He works out frequently. He does have well-controlled hypertension, and he takes medications for this and a statin for his elevated cholesterol. He drinks alcohol occasionally. He doesn't smoke. He's married, and his erections are normal. He was noted to have a relatively normal digital rectal exam that was round, smooth, slightly enlarged, but his PSA was 4.5 nanograms per milliliter. I like to review the prostate anatomy with patients. The prostate is typically the size of a walnut, measures about 30 grams, and is part of the urethral channel. It's tucked in between the bladder and the rectum, and the backside of the prostate can be palpated by performing a digital rectal exam. The function is a reproductive organ, and it contributes to semen. What we do know is that prostate cancer is common. It affects 1 in 8 men in the United States. If detected early, the 5-year survival rate is nearly 100%. The goals with prostate cancer screening are to minimize the detection of non-life-threatening cancers and maximize the detection of intermediate and high-grade cancers, as well as decrease the unneeded biopsies and treatment. As established by the American Urologic Association on the early detection of prostate cancer. What we mean by early detection is screening, and both imply detection of a disease at an early pre-symptomatic stage when a man would have no other reason to seek medical care. The panel recommends against PSA screening in men less than the age of 40. In this age group, there is a low prevalence of clinically detectable prostate cancer. The panel also does not recommend routine screening in men over the age of 70, unless they are in excellent health and they may benefit from screening. The panel strongly recommends shared decision-making for men in between the ages of 55 and 69 with either their primary care physician or urologist, and then proceeding with screening based on a man's values and preferences. How do we find prostate cancer? The two most common ways are a blood test measuring PSA or prostate-specific antigen, as well as a digital rectal exam. Screening is best performed when these two are taken in combination. Typically, PSA and digital rectal exam are done annually for screening, but this does not tell you if someone has prostate cancer. You need a prostate biopsy in order to make the diagnosis. PSA stands for prostatic-specific antigen. It's a protein in the semen that liquefies the ejaculate. It circulates in the blood of all men with intact prostates. The good news is PSA is only made by the prostate. However, prostate levels can be elevated for several reasons, such as inflammation, trauma, or natural enlargement as men age. I think a lot of men need to know, what is your PSA and what is the trend? What is the velocity? How quickly is it rising? One of the earliest known biomarkers used in urology. It's used in several phases of the disease, including screening, diagnosis, after local treatment, in advanced as well as metastatic disease. In regards to PSA screening, from a urologist's perspective, most would agree that mass screening is in the past. PSA does have several limitations. It's not a definitive test for prostate cancer. Shared decision-making is important. High-risk patients, such as those with first-degree relatives and family members, should be considered for screening. Age and comorbidities will often dictate who gets screened, which is also dictated by primary care providers. Who gets biopsied and diagnosed is often dictated by urologists. The National Comprehensive Cancer Center also has their guidelines on the early detection of prostate cancer. If a PSA is less than 1 nanogram per milliliter and there is a normal digital rectal exam, repeat testing can occur at longer intervals. If a PSA is in between 1 and 3 with a normal digital rectal exam, repeat testing should occur at 1 to 2 year intervals. If a PSA is greater than 3 or there's a suspicious nodule on digital rectal exam, the PSA should be repeated and this patient referred for possible biopsy. In these patients, we would consider the use of multiparametric MRI as well as biomarkers. If there remains a high suspicion for prostate cancer, these patients should undergo prostate needle biopsy. If there's a low suspicion for prostate cancer, the PSA and digital rectal exam can be repeated at a shorter interval. In my practice, I often use transabdominal ultrasounds to determine the size of the patient's prostate. By taking the PSA divided by the prostate size, we can determine the PSA density. The denser the prostate is, the more concern there is for prostate cancer. Biomarkers available for risk stratification in patients with suspected or known prostate cancer. Biomarkers are biologic molecules typically found in blood, urine, or tissue that can be used as a marker of normal or abnormal processes within the body. Biomarkers can be used in all aspects of patient care. They can be done before a biopsy, prior to repeat prostate biopsy, after biopsy, or post-treatment. Biomarkers should, however, not be routinely used in all patients. I use SelectMDx, which is a urine-based biomarker in my practice. I will use this for patients that have had a negative prostate biopsy in the past. Those patients with a very large prostate with a smaller concern for prostate cancer, and those patients that may be in the gray zone or hesitant to proceed with prostate biopsy. The assay looks for 2 genes, HOXC6 and DLX1, that have been shown to be associated with prostate cancer. Findings associated with the digital rectal exam, the PSA, the patient's age, and the prostate size are combined into a report that tells us the likelihood of finding prostate cancer upon biopsy, as well as, more importantly, the likelihood of detecting a clinically significant prostate cancer, which is considered a Gleason 7 or greater. I will also typically use multiparametric MRI frequently in my practice. In patients considering a prostate biopsy, all patients will undergo a multiparametric MRI, which stands for magnetic resonance imaging. There are several sequences performed in the MRI, and we can evaluate the MRI for suspicious areas within the prostate if there is evidence of extracapsular extension, seminal vesicle involvement, lymph node involvement, or possible bony metastasis. The radiologist will give us a score, PIRAD score, from 1 to 5. And I think it's extremely important for men to know, what does my MRI show? Does it show any PIRADs 4 or 5 lesions? And where are the lesions? Another imaging modality that is currently being employed is micro-ultrasound. This is a high-resolution ultrasound probe that provides real-time images similar to a standard transrectal ultrasound. This can be used in both the initial biopsy phase and the surveillance phase on patients diagnosed with prostate cancer. The images provided by micro ultrasound are far superior and can provide detailed local anatomy. It also has a very similar scoring system to the PIRADS system called Primus. The higher the number on the Primus score, the higher likelihood of finding clinically significant prostate cancer. Prostate biopsy is typically performed transrectally, and the goal is to sample the peripheral zone of the prostate. On average, 12 cores are taken, 6 on either side, in the peripheral zone of the prostate. The prostate biopsy will tell us, is there prostate cancer or not? What is the Gleason grade, which is the aggressiveness of the prostate cancer? Gleason 6 prostate cancers are the least aggressive, whereas Gleason 10 prostate cancers are the most aggressive. The prostate biopsy also estimates the volume of the cancer, the number of cores involved, what is the location, and if there is perineural invasion, which is a poor prognostic indicator. There are 2 standard ways to perform a prostate biopsy. One is via the transperineal, and the other is via the transrectal route. Both are typically performed in the office under ultrasound guidance by a urologist. The added benefit of performing the transperineal biopsy is that anterior aspect of the prostate is more easily sampled. There may also be a slight decrease in the risk of infection via the transperineal route, although recent data is questioning this. Multiparametric MRI ultrasound fusion is a technique used to sample lesions noted on MRI. After the MRI is complete, the radiologist will encircle the lesion on the MRI, and then these images can be fused in real time to a standard transrectal or perineal ultrasound to ensure that the lesions that are noted on MRI are sampled. As prostate cancer can be found 15 to 20% of the time in other areas of the prostate without a lesion, usually the fusion-guided biopsy are also performed with the standard 12-core needle biopsy. After the prostate is sampled, the cores are all sent to a pathologist for evaluation and are given a Gleason grade, which ranges from 6 to 10, 10 being more aggressive. Patient needs to know, what is my current Gleason score? Once we know the Gleason score, the number of cores involved, the PSA, the digital rectal exam finding, the patients are given a risk category ranging from very low, low, intermediate, high, and very high risk. This will determine the extent at which imaging studies need to be performed for evaluation of disease outside of the prostate. In patients with low and favorable intermediate risk disease, genomic biomarkers can be performed on tissue removed at the time of biopsy. This will determine the biologic aggressiveness of the prostate cancer. This is useful for patients considering active surveillance. In patients found to have unfavorable intermediate risk, high risk, and very high risk disease should undergo additional imaging to ensure that there's no metastatic disease or disease outside of the prostate. Traditional imaging includes CT scan of the abdomen and pelvis, as well as a bone scan. Although CT and bone scan are still widely being used for imaging, slowly this is being supplanted by a more sensitive test called PSMA PET scan. PSMA stands for prostate-specific membrane antigen. This is a protein found on the surface of most prostate cancer cells. A radio-labeled pharmaceutical agent is tagged to PSMA. The whole body is scanned, and this will easily identify areas outside of the prostate where there may be prostate cancer metastasis. After a diagnosis of prostate cancer, many men will ask, how can I be proactive in my fight against prostate cancer? One of the fathers of prostate cancer treatment is Professor Laurie Klotz from the University of Toronto. He recommends smoking cessation, consider a low-dose statin, vitamin D supplementation, as well as metformin. In summary, prostate cancer is common and its aggressiveness is quite variable. Earlier detection is favorable and can lead to a cure a lot of the time. Our goal with prostate cancer screening is to maximize detection of intermediate, high, and lethal cancers, minimize the detection of non-life-threatening cancers. We can do this with improved imaging and genomics, which can improve risk stratification. This has also allowed urologists and patients to be more comfortable with active surveillance. Thank you for your attention.
We are grateful to Dr. Vason for providing this video. My name is Faina Stern. I'm a physician and president of the nonprofit AdMeTech Foundation, leading regional, national, and global programs in prostate cancer education, research, public awareness, advocacy, and clinical care equity. My thanks to Brockton NAACP for the great partnership in creating this prostate cancer awareness event specifically, and for continuous long-term partnership since 2015. Dr. Sean Vason described recent advances in patient care. The main topic of my presentation is our prostate cancer equity program and its mission to bring the cutting-edge advances in patient care to Massachusetts men and eliminate health disparities. Prostate Cancer Equity Program is an integral part of the AdMeTech's ongoing statewide program in prostate cancer that created a Massachusetts model of national leadership in public awareness, medical education and research, and clinical care equity. We are grateful to the Brockton delegation to the State House who made this program possible. Our primary focus is on high-risk men, Black, Hispanic, and Latino individuals, and all men with family history of prostate cancer and increasing age, 50 and older. This program was initiated since 2013 in collaboration with multiple organizations and has 4 components: public awareness, community education, prostate cancer equity and clinical care, medical education, and research. Our public awareness campaign, community education and outreach, is focused on the most vulnerable and underserved individuals. Since January 2023, we reached over 15,000 underprivileged individuals. This is a 50% increase compared to what we reported last year. Since 2019, our public awareness and education program reached over 52,000 people. For public awareness and education, our messaging is centered on the importance of screening and early detection critical for saving lives. Early detection is particularly important for Black, including Hispanic men, who are 2.5 times more likely to die compared to white men. With early detection of prostate cancer, every man is alive in 5 years. In sharp contrast, with late diagnosis, when cancer is spread to other organs, only 28% of men remain alive at the same time. The center of our medical education is AdMeTech's annual Global Summit on Precision Diagnosis and Treatment of Prostate Cancer. The latest 7th annual conference took place in September last year. Our summit has been recognized as a seminal event in shaping the state-of-the-art and future vision for patient care. Our summit brings together the key international experts representing every clinical expertise to review the best emerging clinical practices and research priorities. Last September, we had over 300 physicians participating during this event. After the event, our media partners published over 60 scientific presentations and reached over 35,000 physicians across the globe. It's difficult to find any corner of the world that has not been reached by this event. Our summit showed that equal access to high-quality care is the key factor in improving patient outcomes for all men and eliminating health disparities in Black men. It is particularly important now with so many novel diagnostics and therapeutic approaches ensuring high quality, personalized, precision patient care. Without equal access to these advances in patient care, we will see a widening gap in health inequalities, including survival and mortality. Consequently, AdMeTech launched the Prostate Cancer Equity Program in Massachusetts in collaboration with Mass General Brigham, UMass, and other clinical institutions, with the mission to save lives and deliver high-quality care to all. Supporting organizations include Latino Health Insurance Program and multiple NAACP branches located across the state. Any Massachusetts man age 40 and older can participate. Our priority focus is on Black, Hispanic, and Latino men who are at higher risk of prostate cancer, delayed diagnosis, poor quality care, and death. Our goal is to expedite access to leading experts who use the most advanced approaches to screening, diagnosis, and treatment available today, and to support men every step of their medical journey. This program helps men to find an expert for the initial or a second opinion, in-person or virtual visits. We strongly believe that our prostate cancer equity program, integrated with our large-scale public awareness campaign, has been placing Massachusetts in a strong position to become the first state in our country to eliminate health disparities. Experts of the Prostate Cancer Equity Program can address any questions about prostate health, from assessing an individual healthy man's personal risk of cancer, to informing men about all available options before and after screening, biopsies, and treatment. We are committed to supporting men during every step of their medical journey to ensure that no man is left behind or struggling alone. To achieve this goal, we created a streamlined VIP-style process of patient referral and care, reflecting how doctors involved in this program take care of their families and friends. This process consists of three components. One, AdMeTech Foundation's team members collect basic information and match individual patients' needs with the appropriate state's experts for clinical care. Two, a clinical organization designates a patient navigator to expedite a medical visit and related needs, including scheduling, registration, transportation, any insurance, and financial assistance if needed. Three, if an expert recommends any next steps, AdMeTech's team and patient navigator work with men on the appropriate follow-up, such as testing or treatment. We asked a few men to share how Prostate Cancer Equity Program has been making a difference for them. The first video was provided by Jose Javier of Lawrence, Massachusetts.
Hello, everyone. My name is Jose Javier. First, let me begin by thanking Dr. Stern for inviting me here today and being part of this. I'm excited to share with you and grateful to be able to share with you for a few minutes a little bit about my story and my experience with AdMeTech in the organization. I met Dr. Stern around the fall of 2015. I heard about her from a friend of mine at church, Victor McCann, which I'm grateful for because he was going through the same thing and he was able to share at church, and I heard his testimony, and I was able to approach him after the service and we had a great conversation. I was very shy about this subject. I too had a very high count of my PSA exam and had to go in for a biopsy. And I learned from Victor McCain the difference between an MRI biopsy, a guided biopsy, and also what is referred to as a blind biopsy. And those made a difference in my life. And I was able to meet Dr. Stern through this process. And I was able to go in, get a MRI guided biopsy at the NIH and so forth. And it was a fantastic experience for me. So for me, part of the takeaway when it comes to this is really to be aware. Be aware, learn about the processes, learn what's available out there, what programs are available for you, what are the best tools to do the job. A very important thing is to share it. That's what I learned from my friend Victor, is to share share it at church, share it with other people so they can learn as well. And because in our community, especially in the Black American community and the Latino community, it's a subject that is not often spoke about. When we talk about our private parts and speaking about the prostate, it's not always a conversation that is too welcoming in our community. So I would encourage people to share it, to learn. And as Governor Baker always says, get tested. You know, it's easy to get tested. Ask your doctor for a test and be aware and that there are solutions out there. We have great referrals, we have great doctors, and contact the leadership, the people at AdMeTech, and they're able to guide you in the right direction. Thank you. Please allow me to say a few words in Spanish. Para nuestra comunidad en español, este tema de cáncer en la próstata es un tema súper serio, muy serio, y es un tema que nos impacta a nuestra comunidad significantemente. Yo le quería decir a ustedes que, por favor, hablen con su médico si sienten algún síntoma, si están teniendo problemas orinando, cualquier irregularidades. Hablen con su médico, no tengan miedo de conversar con su médico. Hablen con personas que tienen experiencias similares y eso le puede salvar su vida. Lo más importante es hacerse un examen PSA. Por favor, estudienlo bien y aprendan más. Gracias.
The second video features Ronald Roberts, who was referred to us by Martha's Vineyard NAACP.
Hi, everyone. I'm so glad to be here. My name is Ronald Roberts, and I'm just so glad to be included in this presentation. I have known about AdMeTech, and I met Dr. Stern years ago, and I would have never thought that I would be needing them so much last August when I was diagnosed on July 4th with prostate cancer that had spread to about 3 organs and lymph nodes, and I was in really bad shape. I ended up talking to Dr. Stern later on, and she directed me in the right direction. I ended up at Dana-Farber and jumping around to Brigham and Women's. I'm just fortunate. I consider myself fortunate to live in Massachusetts, where the medical help is available. If you know where to go, it really paid off for me. I'm doing pretty well after going through the MRIs and using the advanced equipment was provided to me. But through the direction of AdMeTech, I got to the right places. It takes a lot of willpower and positive thinking to do and go through what I did. I ended up driving over 3,600 miles, and that was after I had a driver that used to take me when I was weak. When you add the radiation, chemo in, 34 more appointments, it comes out to a lot of appointments, and I made every one. It was nice to know there was always somebody in the background that could help out if I had I needed an opinion, and that was AdMeTech. And to bring people like myself that are patients, been exposed to the cancer, and survivors and people from the medical field and politicians, it's something that's badly needed for the minority community. We have the knowledge there. Things have changed a lot in terms of prostate cancer for the better. I'm taking a drug that's only 3 years old that has excellent results, but you got to know where it is and you got to be guided in the right direction. It's kind of frustrating that there's so many people out there that do have it and are not getting the help or not getting the proper help. I had put it off for years. I knew back in 2010 when I had Lyme disease, relapsing polychondritis, and babesiosis, and I forgot what else, all at the same time. I tried to treat the cancer back then with chemo, and it just got worse. So I just put it on the back burner. And I didn't even feel anything up until the few months before I was diagnosed, and that was I couldn't hold food down too well. Fortunately, a lot has changed since 2010, 11 when I was treated. There's a lot out there, a lot of new advanced machinery that can help with MRIs and radiation. We're fortunate in Massachusetts to have it available, and especially the Boston area. Without AdMeTech to guide you and be a resource, it's just so crucial if you need it, because sometimes you got to make a decision as to what the treatment is, and everybody's different. The reason I waited so long is trust, and that's a big thing. I have met other patients that have had mistakes or things didn't go right, and finally they got the right help. And waiting and insurance problems, and that's something that could be avoided or hopefully streamlined, and that's what AdMeTech is there for if you catch it early. And it is so important to get tested early and continue the testing. The primary doctor should know more about AdMeTech. And one other thing, with the testing that I did do and all that I went through, what helped me, if nothing else but mentally, was getting a DNA test. My father had passed from prostate cancer at about age 84. So I always thought it was hereditary. And through the DNA testing, I found it wasn't. But I do have the gene that causes colon cancer. And around December, I got a notice from, I think it was Dana-Farber, that that gene could possibly cause prostate cancer. And DNA testing also helps for alternative treatments. So it's good to do, and it's also, it helps my nephew and all know that they got to get tested and what to look for. The good thing about all this is there's a lot of research and things are changing fast. So even if you are sick, if you can hold in there, there's more on the way that could possibly help. Once again, what I did this past year, I couldn't do back in 2011. It wasn't available. And the idea of research and studies, and you do get a lot of notices for that. Probably scares people too, because we think back to the Tuskegee study. I'm probably going to benefit from one of the studies they're going to do on me, and that is exercise in relation to the hormone therapy, the heart. So I'm looking forward to that in June. It's quite a study, quite a bit of exercise. I'm going to end it there.
Emma Couillard serves as a manager of the Prostate Cancer Equity Program. Emma is assisted by Erin Roberts, program coordinator, Greg McClay, a patient educator, and other members of the AdMeTech Foundation's team. When you come to us, Emma will work with you, our team, Mass General Brigham, UMass, and other clinical partners to expedite medical visits and address any needs you may have. Our team may not be able to right every social wrong that cannot be resolved by federal or state government, or provide perfect solutions for every man. And yet, we are committed to doing our best and making sure men are not left behind or struggling alone. If you have any questions about our program or need assistance, please contact Emma by phone, 617-523-3535, or by email, coordinator@admetechfoundation.org. Thank you for your attention. Do you want to say a few words about Prostate Cancer Equity Program from your perspective?
Sure. Hello, everyone. As Dr. Stern said, my name is Emma Couillard, and I'm the manager of the Prostate Cancer Equity Program. So if you were to call into AdMeTech, I would be the first one who you would talk to. And I'm really passionate about this program because it allows me to help people with really simple things that might make their life a lot easier, especially when they're going through something that can be really scary or confusing or challenging. So I'm able to work with the patient navigators at the institutions that we work with, so you don't have to deal yourself with any of those issues with health insurance, transportation, financial issues, any of those types of things, scheduling, and it just makes your experience much more streamlined, and you get to work with the best experts in Massachusetts. So I'll just end with a call to everyone on this call tonight that if you have any questions or concerns about yourself personally or any of your friends or family members, please feel free to reach out to me. I'm going to put the number and the email again in the chat, and both me and Dr. Stern are here to support you and help you in any way that we can. Thank you.
Thank you, Emma. And I really want to second our call to action today. For a number of years, we had public awareness educational programs to empower men to know the risk and to take charge of their health. Right now, help is here. Prostate Cancer Equity Program is here. If you have any questions about this program, if you need any help, if you need more information about Prostate Cancer Equity Program, Emma is your point of contact, and together we'll be able to get you to the best experts in Massachusetts and internationally. Another person who represents our program today is Craig McClay. Craig, do you want to say a few words about this program and what prompted you to agree our invitation to
Absolutely.
help
Thank
with the program?
Absolutely. Thank you, Dr. Stern, and good evening, everybody. I mean, there's multiple kind of pathways and belief ways that and values that the AdMeTech Foundation as well as the NAACP embrace that I hold close to my heart. And outside the obvious, being a man of color in that catchment area of about, I know I don't look it, but I'm about 50 years old. I'm not about 50 years old. I am 50 years old, and a lot of my friends are in this age range as well. And growing up, seeing a lot of folks without their parents, now that I'm at this age right now, I really would like to contribute to any types of forces, whether it be health or socioeconomic courses that help keep my brothers on this planet a lot longer, stay connected with their families. And this is one avenue that it's kind of like this silent creeper, in that it goes undetected and unnoticeable. But you have to be proactive in order to get in front of this thing. And in doing that, I saw AdMeTech kind of leading the way on that, and it was like no other place is doing this. So let me join forces with them to kind of help spread the word, and get the word to as many people as possible. In addition to that, I've always my pedigree is in youth development, and I heard the gardeners tell one day, and it just made me think about who are the people that our young people spend most of the time with, their parents and their teachers. So how can we better take care of parents and teachers, so that they can bring their best selves to the fore to better the life outcomes for our young people. And again, this program checked another one of those boxes for me. So, and then I got to meet the team here, and I mean, it was just, okay, it's a no-brainer now. Like, you got some of the best and brightest resources and doctors on the planet that are here to support this, thanks to the leadership and the vision of Dr. Stern. Why not? I mean, like, simply, why not? So I'm grateful to be a part of this team. I believe in the vision that Dr. Stern has. They got some resources to make this happen. They got a team of skilled individuals, and we have an action plan. Now we're just looking for other folks to join us in this, so that we can create the changes that are necessary to save lives.
And at this point, I would like to ask if anyone has any questions that we can answer.
Yes. Is there a way that you can shrink and enlarge prostate?
Yes, there are actually both medications and minimally invasive surgical procedures that make it possible to eliminate enlargements, undue enlargement of the prostate, and all the related symptoms.
What does urine in your blood mean?
Urine in your blood? Do you mean blood in
I
your
mean
urine?
blood in your urine. Yeah, I'm sorry. Yes.
Okay. Thank you for your question. It means that for some reason, blood is leaking. There is no, under normal circumstances, there is no blood in urine. When there is blood in urine, that means that there is some sort of problem, and normal barriers that prevent blood from going into urine broke down. Breakdown of these barriers associated with leakage of blood into urine can be infection, urinary tract infection, UTI. It can be trauma. It can be inflammation of the prostate. So and it can be cancer. So it's fairly common, but non-specific symptom that needs to be very carefully evaluated. If, for example, If it is, if you were put on antibiotics and you no longer have blood in the urine, it's gone. It is probably you need to what you and your doctor need to watch out for that. But if it is gone, there is no need to worry about this right now. But if it was not clearly related to infection, this needs to be looked at very, very carefully. It also, blood in the urine happens when the problem can be prostate, the problem can be bladder, the problem can be kidney, or any part of joint urinary tract. Any other questions? Did I address your question?
Yes, you did.
Okay. Any other questions?
Dr. Stern, I was really waiting for the audience. Are there any other questions? I just have 2 questions for Dr. Stern. I just don't want to interrupt the audience at all. I don't see anybody. Dr. Stern, I just got to ask you this question because, I'm one of those that watch the doctors on TV. I'm not going to give away my age back in the day, but I don't understand something. When you talk, or maybe you can explain this to us fairly quickly, what is the difference between stage 2, stage 3, and stage 4? Because when I heard Brother Roberts talking, he said that there is a survival rate with respect to stage 4. But if you're watching any of this stuff on TV, stage 4, the doctors are telling the other actors, you need to go home and prepare. Is that not true? Tell me a little bit about these stages, please.
Yes or no, Tony, because there have been such an incredible, as Dr. Wason's talk demonstrated, there have been such incredible advances in diagnosis can be controlled fairly strongly right now with medication and other interventions. So stage 4 essentially means that you have metastasis, that prostate cancer has spread outside of the prostate and even maybe into distant organs, such as, for example, bones. Very frequently, metastasis from the prostate cancer go to the bones.
Wow.
Stage 2 is a fairly early stage of prostate cancer. Stage 3 is somewhere in the middle when there is probably likelihood of local. It means that men do not have distant metastasis, but there is a risk of prostate cancer spreading beyond the prostate, locally, regionally. Okay. And of course, the earlier the stage, the easier is the treatment and the fewer complications of treatment. And I just want to mention that one of the most promising directions right now in the treatment of early prostate cancer is minimally invasive treatment. When men do not even need to get admitted to the hospital, they do not even need to have surgery. It's actually men under imaging guidance, you can see exactly where cancer is, and without using the knife, you can eliminate this cancer through destructive energy. That can be radiation or other source of energy, ultrasound and lasers, etc., etc. So this treatment has actually very few complications to men and drastically reduced cost. So this is still area under development, and we just established international working group to expedite transfer of this minimally invasive treatment from research to standard of care, as we've done with many other clinical tools. But this is something that will be for men with prostate cancer, for early stages of prostate cancer. What minimally invasive lumpectomy has become for women with breast cancer. Very few women right now are getting a radical mastectomy, radical surgery. It was, minimally invasive lumpectomy replaced radical surgery in most women.
Dr. Stern, and I know we're getting, but I have to ask this question because I heard someone, and again, charge it to my mind, not my heart. Someone mentioned DNA, and I don't remember the years that I've hosted this, have I ever asked this question. Is prostate cancer hereditary?
Actually, it is.
Oh, okay.
And men who have father with prostate cancer or brother with prostate cancer are particularly likely to develop prostate cancer later in life, after the age of 40.
So is that 40? Or so are we still locked into 40? Or should, if I know my grandfather has had it, my dad had it, my great-great, why am I not being tested at 35? I'm just asking.
Oh, why not 35? It is, first of all, we've known cases of one of my friends had prostate cancer at the age of 36. But when you make recommendation for a lot of men, for a group of healthy men to undergo screening, you need to weigh benefits and harm. And based on based on research in a lot of men, we are talking about thousands and thousands of men, it was shown that doing screening for healthy men without symptoms, even at high risk of prostate cancer, men who are younger than 40, that's where harm outweighs the risk.
Thank you.
So we do not recommend, even for Black men, even for those who have family history of prostate cancer, we do not recommend screening below the age of 40 unless there is a compelling reason.
Thank you, thank you, thank you. We're at that 8 o'clock hour. I don't know if there's any other questions at all. Dr. Stern, I think I can go on and do some closing remarks unless you have something else to add.
I just want to again repeat that if anyone needs any help, if anyone has any questions about our program, if any of your family members, if any of your friends, community members need help, Emma and I are standing by to provide any help that is needed, and we promise to take great care of you.
Awesome.
Thank you so much for this program this evening. Oh, every time I think this is the best, and tonight you really outdid yourselves, and it was a wonderful, wonderful program, and we all learned so much, and the testimonies we hear make all the more reason for all of us to spread the word about prostate cancer awareness.
Thank you so much. Thank you.
Very well. So I want to listen, we're a little bit beyond the 8 o'clock hour, and I promised myself to make sure that everybody got recognition. I was going to read from my note here. I want to thank Janet, thank you very much. I want to thank the Brockton Area NAACP Health Committee, President Ellis for her leadership, AdMeTech. Oh, you all are awesome. You are saving lives. Exactly, Janet. We want to thank you, Dr. Stern, and your team, especially around equity, and more equity. Want to thank the political leaders, the clergy. Want to thank the survivors for giving their testimony, that we have oral history regarding the successes that are happening to save lives. People want to be encouraged. So we needed to hear those testimonies. We celebrate each and every victory, especially, again, what the survivors have said. We are willing to see a brighter day tomorrow because of the great work that AdMeTech is doing. To Dr. Stern's point, no man will be left behind. Ladies and gentlemen, this has been AdMeTech, the Brockton area branch of the NAACP. We are Brockton's choice for civil rights news. Have a great day.
Thank you, Tony.
Thank you so much.